So at this point, I'm going to introduce you to the chair of our meeting today, who will then get us underway with the introduction of our first speaker. And our chair is Dr. Sylvia Asa.
Thank you, Jackie. It's with mixed feelings that I welcome you all today. It's great to see so many people here. It's also not great to see so many people here because we'd like this disease to go away. But as we continue to do our work and find ways of diagnosing, treating, and curing it, we're going to have a wonderful day filled with lots of great speakers. Our first speaker is a particularly important one, and I'd like to introduce Lynn Getz. Lynn is very important because she's a patient, and she's an extremely well-spoken, outspoken patient who's going to give you a lot of insight. So I'm going to ask Lynn to introduce the conversation for today. Please, Lynn, come forward.
Good morning, everyone. Can you all hear me? My name is Lynn Gates, and I am a NET patient. Let me begin by saying how much I appreciate being in a room filled with people who understand what it is like to live with this disease from both sides of the gurney, certainly a select group. I will use this time to share some of my own experience with this disease. I was diagnosed with breast cancer 9 years ago at North York General Hospital in Toronto. I had surgery, chemo, and radiation, and was cancer-free for 5 years on tamoxifen. 3 years ago, my oncologist at North York General ordered routine tests before switching me to another drug. These tests led to a CT scan where significant metastases was identified throughout my whole liver and in some of my lymph nodes. My oncologist came to the logical assumption that this was metastatic breast cancer and ordered a biopsy. We were all fairly devastated at that possible diagnosis. She asked a palliative care doctor to sit with me as I recovered from the biopsy. He sat with us for 3 hours. His warm presence was a tremendous comfort to me and to my husband, Greg. We were slightly stunned when the biopsy revealed that these were not breast metastases, but NETs. We knew this was better than metastatic breast cancer, but we still spent 6 weeks wondering what all this meant before our first appointment at Princess Margaret. I was diagnosed as grade 3 with a Ki-67 number of 33. My primary tumor, or maybe tumors, are in my small intestine. My chromogranin A was over 100,000 before treatment, a reading that most of my oncologists had never seen, but it has settled at around 2,500 since treatment. I had not experienced symptoms except for some cramping, a nose as red as Rudolph's, and ongoing flushing, which you can probably see right now, which were reminiscent of hot flashes. And I thought I had the longest menopause in recorded history. However, shortly after I was diagnosed, I became quite ill for many weeks. I was fainting or coming very close regularly. I often felt very faint in the shower, and I spent many mornings crawling out of the shower and laying on the bathroom floor, waiting to feel well enough to stand up. I did pass out in the shower, on the street, and in the grocery store. I lost over 20 pounds. Unfortunately, I've gained 10 back. I was running fevers, and I had a racing heart rate. I ended up in the hospital. I was not a candidate for surgery. I now have, for the last 3 years, a monthly injection of 120 milligrams of lanreotide, Somatuline. I've completed 24 rounds of CAPTEM, which I tolerated fairly well, except for the last 2 days of the 14-day cycle, when I had difficulty getting out of bed. I had 2 bland liver embolizations. I experienced significant pain and other side effects with those procedures and ended up in the hospital for longer than expected. I just recently had my gallbladder removed. Fun and games all around. But I am now stable and my symptoms are very much improved, although certainly not all gone. I was turned down for the PRRT trial in Toronto. I am in a waiting period now, waiting to see if there's more tumor growth, if I can get into a trial, or if not, considering Afinitor or more Captem. All of this is enough to drive you to drink. However, like many of you, I cannot tolerate alcohol. Why, oh why couldn't it be something like, let's say, kale, that I couldn't tolerate? I do miss a good glass of red wine with dinner. All of us here have had troubling experiences from the disease and the side effects from the treatments. Some of them putting us in hospital. They are difficult to cope with and have significant impact on our lives. However, this disease also has significant psychological and emotional side effects, as all of our caregivers can attest to. My symptoms are not constant. They vary day to day and even from morning to evening. Sometimes I feel quite sick, and sometimes I feel almost normal. Because this disease presents in many different forms, doctors don't always understand how individual bodies will react. This can make you question your own perceptions. People tell me, and I know they tell all of you because I'm looking at you, you look great. You can't have cancer. I like Ronnie Allen's reply to this. You should see my insides. One of my surgeons recently said to me that she had never seen a gallbladder in such terrible shape in a woman that looked so good. This day-to-day experience leads me to ask myself often, am I sick? Am I not sick? I have struggled to come to terms living with a chronic disease. My past experience has been that you have an infection or a virus or a broken leg, you take the medicine or follow the treatment plan, and you get better. Even for my breast cancer, I had the surgery, the chemo, the radiation, and my breast cancer has not returned. NETS is often not diagnosed until there is metastases, and even these tumors are most quite often indolent. It is not likely to be totally eliminated, though. So we live with a chronic but potentially terminal disease. It's difficult to get your head around this. There is also scanxiety, waiting for the results of your latest scan. You know it is a matter of time before you show tumor growth, and sometimes you find yourself in the perverse situation of hoping for growth so you can be considered for a treatment or a clinical trial. I struggle with all of this constantly. I have some strategies that help me cope. My husband and I have made use of the psychosocial resources at Princess Margaret, and based on our experience at North York General, we hooked up with a palliative care doctor when I was so sick before I started treatment. People wonder why I should be seeing a palliative care doctor. I'm obviously not dying imminently. However, we only see her every 3 or 4 months, and studies show that cancer patients live longer and live better if they connect with palliative care early. She has helped with symptom control, and we really appreciate the relationship we have with her. I figure as many people as I can get in my corner, the better. I recently heard an expert on CBC Radio talk about 5 practices that contribute to good mental health. I decided to think about them in terms of my own life. The first practice is staying connected. I'm lucky to have a wide circle of friends that I have accumulated over 70 years from various aspects of my life. I work to stay connected with all of these people. I am retired, so I can do this more easily, and I often have meals, go for walks, or go to various cultural places with friends. The CNETS community is a great way to stay connected with others who share your experiences. One of my greatest frustrations has been that I did not find out about CNETS until my 2nd year of treatment. The handbook, the support, and information meetings, and the website, as well as the Facebook page, have been very helpful. The next practice in good mental health is regular exercise. I have a workout plan that I do 3 or 4 times a week. I walk with and without my dog for 45 minutes a day. I use the subway all the time, and I never get on an escalator. I always use the steps. Exercise makes me feel better, both physically and emotionally. I know that I'm very fortunate to be well enough to stay this active, but I also feel that staying active contributes to my wellness. The third practice is mindfulness. For me, mindfulness is not dwelling in the past or worrying too much about the future, but staying in the present and appreciate what is happening in your life right now. For me, this mindfulness manifests itself in a deep sense of gratitude. I have a great life. I've been married to the same wonderful man for 50 years. I have three adult children who are all good people, and I have the 4 most fabulous grandchildren in the world. I had a meaningful and gratifying career as a school principal. I am deeply grateful for my life. I am also extremely grateful for the medical care I receive in Canada, and especially in Toronto. Having government-funded medical coverage has a huge impact on our physical and our psychological well-being. Having access to doctors who are devoted to understanding and treating this disease makes all the difference. I have had timely procedures and tests. I got compassionate coverage for CAPTEM, and Ontario covers the cost of my lanreotide injections. Both of these could end up costing almost $6,000 a month. I feel very lucky and very grateful. Part of being mindful for me is acknowledging that I am probably going to die from this disease earlier than I might have normally. This can be challenging in a death-phobic society like ours. Most of us can identify with Woody Allen when he says, "I'm not afraid of my death. I just don't want to be there when it happens." Acknowledging death as a reality enhances my gratitude for my life and the many small episodes of joy and beauty that surround me on a regular basis. As Frank Ostasecky says, death is the secret teacher hiding in plain sight, helping us to discover what matters most. The next mental health practice is to be continuing learning. I am learning very slowly to play the harp. I am a voracious reader. We love to travel and visit cultural attractions. The last effective practice for mental health is giving back. I find that several of my activities combine a couple of these practices. Singing in a choir at my church enables me to connect with others in a special way and to constantly learn new music. Tomorrow we're doing a very difficult Bach cantata. Being part of a congregation provides me with care and support and gives me deeply meaningful opportunities to care for others. I work as a patient partner at the University Health Network, and this enables me to connect with others, to learn a lot, and try to make things better for other patients. As a patient partner, I have shared my medical experiences, mostly good and some not so, on many committees and task groups, including speaking to the UHN Safety Council, working on the Quality Improvement Plan, being involved in making decisions about aspects of the Princess Margaret renovation, sitting on the Transfer of Information Working Committee for the accreditation of the hospital, to name just a few. I find all of this immensely rewarding. I have met wonderful people and learned a lot about the medical system. Patient input is finally being sought and appreciated. I believe we have the potential to enhance the care for many patients and the work experience for all staff. I have recently become a member of the board for CNETS. I really look forward to this work. CNETS has organized this excellent conference. Attending this conference is a way to stay socially and intellectually active. Learning as much as we can about our disease and treatments enables us to be active partners in our own care. It is hugely important. I want to thank the organizers of this conference and the healthcare providers who have taken time out of their extremely heavy workloads to be here today and to share their knowledge. Thank you so much for listening, and have a wonderful day.